Good afternoon, everyone. We have been called in for a quick decision making on a case conference involving Alex, our Amazon Parrot. First off, to make things really quick and a quick introduction so everyone knows everyone. This is Mr. Leonard, owner and trainer of Alex, who was brought in a week ago. This is clinical veterinarian Dr. Jerry. This is our avian surgeon here at the UE Veterinary Hospital, Dr. Johnson, and our general pathologist here at the veterinary hospital, Dr. Brown. Now, I am Dr. Jordan. I will be your chairperson today. I also have my DVM, just like how these general professionals do. We've been called in because a week ago, surgery on the tarso-metatarsus bone on the right leg proved successful, however, came back necrotic with anaerobic bacteria. It was from a traumatic cage incident that happened. Full stories were given in the conference by Mr. Leonard, and so it involved lacerations as well with heavy stitching. Course of action a week ago was to do surgery to fix this broken bone and to also stitch the lacerations, put on an anti-inflammatory and also an antibiotic. Came back today due to abnormal behavior noticed by Mr. Leonard, and a biopsy was sent of the wound because Dr. Jerry noticed it may be possible infection. An x-ray was taken by avian surgeon Dr. Johnson, and she concluded that the bone has actually healed, but she thinks that paralysis of the digits is causing the necrotic tissue, and this was something that Mr. Leonard, the owner and trainer, noticed today as well. That's why Alex was brought out. We have made our discussions. We have concluded. Dr. Brown, our pathologist, agrees that we should amputate to get rid of the necrotic tissue. Another treatment option put forward by both our clinical veterinarian and our avian surgeon, Dr. Johnson and Dr. Jerry, both stated that they thought the amputation was a better option now because it was the second option when he came in a week ago, and because surgery was unsuccessful, they think that was a good idea. They also think physio may be a possibility with another type of antibiotics, but the probability, as I put forward, is not a full recovery and could lead to welfare issues, and it would just have to lead to amputation, which is what we have decided is the treatment protocol. So what we're going to do is we're going to change the antibiotics, make sure that they're not harsh on birds' kidneys, as Dr. Jerry pointed out. We're going to keep the anti-inflammatory course, and we're going to take the opinions of all three of our doctors here in front of us and amputate as far up to get rid of the necrotic tissue. We decided this is the best treatment plan, and most importantly, the owner did, because Mr. Leonard agreed that the dragon leg was just getting in the way, and he thinks that it would be a possibility. But I just pointed out that in parrots, bumblefoot usually leads to secondary bacterial infection, but however, the probability of getting bumblefoot between amputated and non-amputated was actually the same, so it wouldn't matter terribly if the bird was to get amputated, but that is a possible risk. And he was in agreement, so we are now closing this case conference, and the treatment protocol will be followed immediately. For coming and putting in your opinion. I really appreciate